Niseme ya mwisho. So our government, we are doing the very best to ensure that the citizens of this country get what they deserve. You have seen the issue of housing. Here in Kirinyaga, we have a housing program. We have markets. Some of them are already completed. The issue of healthcare has taken shape right now, and I'm urging every person to ensure that they register. The issue of fertilizer, subsidized fertilizer, I've been interacting with members of the public, and really they have appreciated what His Excellency the President has already done. So we are calling upon unity in our country so that the government of the day can continue serving you with peace, love, and unity. Because we cannot progress as a country when there are problems. And those naysayers, they have already seen that indeed, when people are focused on something, it is achievable. You have seen the young people are now enjoying Wi-Fi, whether it is at the marketplaces or at the digital hubs. It is progress. And before the end of next year, I am sure very many of the projects that have already started, whether it is in roads, whether it is in water, whether it is in the healthcare system, or whether it is in the markets and affordable houses that are being built, most of those projects are going to be at a stage where they are, some of the houses are occupiable. Already you've seen many of them have been occupied, and the roads are passable, and many other things that we are going to do. Mamnataka kusikia nini ingine? Niseme still ongoing, but come January 1st, sisi wote tunarudi kazini. And the one thing that I'm thinking about are the young mothers who are expected to go back to work. And I want to give you statistics that 60% of our infants under 6 months, are exclusively breastfed. So you can see we are still having a 40% somewhere, which is not catered for. We don't know whether they are being bottle fed or something. Then again, we also have a 60% which has stagnated on the initiation of breastfeeding by mothers. So it has stagnated for a long time, since 2014. And we can see that 60%, we still have another 40% where we do not know whether these children have been initiated to breastfeeding or not. But the more alarming angle that I want to talk about is the 22% increase, the increase of bottle feeding from 22% to 34%. And that this reflects a growing shift towards artificial feeding. If we can be able to skip more than 10%, that the children who are being bottle fed in this country are actually increasing. That is why I am insisting that every facility, every company, every institution must build a creche in this country. And this is not my own making, it is the law. The Health Act of 2017 dictates that every institution must have a creche in this country to make sure that this shift of 22 to 34% of children being fed with artificial foods or with bottled milk will reduce. And especially children who must breastfeed below the age of 6 months. I think it is more alarming when there are mothers who are expected to be productive in their workplaces, but they are getting mastitis or any other infection because of not breastfeeding at the right time. And even if the milk is expressed, it is no longer the same, will not be the same as the child who is feeding directly from the mother. So come January, we will ask all inspectors, public health, and also nutrition experts to ensure that we will go around to ensure that we are coordinating with the county government and ensure that there are creche built in every company, every institution, government agencies, schools, where mothers or teachers who are female are expected to also be feeding their young children. That I would want to talk about is the issue of mental health. It's very sad that in my own place alone, I have seen people who have committed suicide, others have been raped, others have been killed. And this is a sickness of our society. And we really, really want to eradicate that. I want to tell the members of public that mental health is sickness. Do not take it lightly. Do not take it like it's a common thing and people laugh about it. When you see somebody collecting papers on the road, please let them seek medical attention. That is the best way that we are able to serve people. That is the best way that we can bring people back to take care of our economy. Therefore, and I want to also urge the members of public and to let them know that SHA is taking care of mental health issues. It is a package that is factored in SHA. Therefore, let people go to hospital and seek help whenever possible. The rise in drugs and substance use. And this is not just in one county. It is in very, very many counties. And it has come to our attention that the war on drugs and substance use is actually now graduating into institutions. And this is institutions of learning, whether in lower primary learning or higher institutions, secondary or tertiary institution. Therefore, we have been carrying out surveys, and some of the young ones we are interacting with, they are also telling us of the habits that are in schools right now. And the initiation to drugs is actually being done by older people, either employees of the schools or people who hang around the corridors of those institutions. So we are not taking this lying down, because we will employ a whole of government approach to ensure that all agencies are joining hands. We will go to those schools and ensure that we unearth any drugs that are with the students. That is in collaboration with the Ministry of Education. And we want teachers to thoroughly check what their students are bringing to school. And especially now when they are going back to school. It is becoming worrying because manufacturers are also targeting youths and the young people. And they have developed sweeteners that resemble undetectable substances. And this could be sneaked in schools and at any given time. If your child is given a biscuit at the gate, is given a sweet, they will not know whether those are drugs or not. And they will be sold at very cheap prices that are manageable by even the students with the pocket money that they are given. So we are calling for vigilance and impromptu checks in classes, impromptu checks in hostels, impromptu checks in dormitories where our children are, just to ensure that drugs are not sneaked into the compound.